Hi everyone, I wanted to come out of hiatus on this channel to provide some input into coping with COVID-19 and a lot of the uncertainty and anxiety that is coming out of that. I'm going to be basing some of these recommendations on my own personal experience, what I've heard other people say that is helping them, as well as a paper from Professor Sanderson at Hofstra University, a presentation from the Chicago School of Professional Psychology, and from some of the tips that Katie Morton gave on her YouTube channel, which I highly recommend that you go and watch after this video as well, and follow her for great tips on things related to the coronavirus as well as mental health in general. So there's a lot of uncertainty right now and a lot that's up in the air. We don't know exactly what the course of the pandemic is going to be. We don't know when places will start reopening, if they'll reopen the dates that they say that they will. We don't know what the result of that will be exactly. Many of the places that we go for entertainment and for stress relief are no longer available to us. We're being recommended to stay home and not spend time in person with our loved ones. Many of us are now unemployed or working remotely, so there's a lot of added stress that comes from the factors associated with that. For parents, they're now spending more time at home with their kids, a lot of them also working remotely, so that's an added strain on top of everything. And hospitals, many of them are recommending that we don't go to the emergency room and go to the hospital unless it's something that's life-threatening or very serious. So there's uncertainty navigating that component as well. So it's natural to feel a certain level of anxiety, fear, and uncertainty. And as a response to a lot of these things, I think we need to accept that we're going to feel anxiety at times, fear at times, uncertainty, sad, depressed, confused. All of those are a natural and normal response to what's occurring. It would be strange if we didn't experience some of those emotions during all of this going on. So before we look at what we can do in this situation to help ourselves and help other people, I think it's important to admit to ourselves that there are these heightened emotions and there is a lot that all of us are experiencing together. Once we're coming at our lives and the situation from a place of accepting what we're experiencing, it's also very important to focus on what we do have control over. It can be very easy to start thinking about how the government is responding or how businesses are responding or what the course will be, but a lot of those are unknown and they're not things that we can directly impact. So while it's useful to discuss those things and keep an eye on what's happening, there can get to a point where we're spending so much time thinking about the variables that aren't in our control that it can increase that sense of uncertainty and fear and anxiety to a point that isn't eliciting action and is just making us unhappy. So there are, of course, many things that we can still control in our lives day to day and in response to the virus in general. So in response to the virus, I'm not going to give like a lot of specific tips because there are plenty of information on professional medical websites and resources to be looked at. But of course, we know that we can wash our hands, we can disinfect surfaces, we can wear masks, we can social distance, and many other things that we can do to prevent the spread that give us some sense of agency. And outside of the realm of specific to the virus, as is always the case, we have control over how we're responding to our emotions, how we're responding to the pandemic, how we're responding to the external environment, and what we're doing day to day. So a big part of that is really focusing on the behaviors that we're doing, engaging in, especially when we're maybe in quarantine or not having some of the normalcy that we usually have. It's important to stick to, develop, and continue healthy habits and routines that we had in place before and explore some new ones as well. So of course, in the realm of developing routine and focusing on what we have control over, there's not a lot of research like specific to this pandemic and this situation, but there is a breadth of research on just behavior change in general and sticking to habits and things that really buffer against stress and anxiety and make us feel more of a sense of control. So of course it's important as always to do things like make sure we're getting sunlight, make sure we're exercising, practicing mindfulness, cooking and eating healthy foods, maintaining a good sleep schedule. And again, now more than ever, especially when our routines are disrupted, we want to be able to take that opportunity to build our own routines, maybe by doing things like planning out our day, tracking our behaviors, tracking our thoughts, tracking our emotions, which can be really incredibly beneficial. And it provides that sense of stability and security for our subconscious and our emotional state, as well as giving ourselves a feeling of control and looking at our day and saying, okay, I have a plan to cook or to work out, to do this task at work, and kind of have that step-by-step process laid out, keeping us feeling like we're on track and we're not just wandering around and kind of in the state of uncertainty with things up in the air and not having a sense that we're still mastering the environment and contributing to something of value and something that's beneficial to ourselves and other people. In terms of how we're thinking about this situation generally and thinking about quarantine generally, there are a couple topics that I think are very important to touch upon, and that's how we're framing the situation and how we're engaging with and responding to some of the automatic thoughts that are popping into our head as a result of this. So Professor Sanderson, in the paper that he worked on with his colleagues and doctoral students, made this point that really, really resonated with me and I thought was incredibly powerful. And that was, rather than thinking that we're being forced to stay inside and we're being forced to stay away from people, we can just as easily tell ourselves, I'm choosing to stay inside and I'm choosing to keep my distance from people. In almost all areas of the world, the governments aren't forcing citizens to stay inside. It's strongly encouraged, but we can, if we want to, go to any drive-through that's still open. We can still go to our friend's house without anyone, arresting us. We're really making that, many of us are really making that responsible choice, and I'd say an ethical choice, to keep distance from people and take as many precautions as we can. So I think in that light, that can be really empowering to think of it as we're doing something that we're fulfilling a moral duty and sacrificing our own well-being potentially to keep others safe. There is also a degree of uncertainty as to what exactly is appropriate. Is it all right to go for a walk in the park? Should you visit your friends at all, even if you keep your distance? So I think it's also easy to start feeling guilty if we engage with people or go out and don't follow all of the recommendations that are being put out, and sometimes there's confusing and contradictory recommendations. So I think that it's also important that while we should generally take precautions, we should also give ourselves permission to make mistakes and decide what is best while following reasonable precautions. In terms of some of the thoughts that are popping through many of our heads, I know certainly is the case for me, is that we don't really know what's going to happen, and our mind jumps to, what if I get corona and I die, or I give it to my parents or my grandparents? And we can start getting into this rabbit hole of imagining our loved ones dying and passing away, the economy inevitably collapsing and never coming back, never getting a job after all this is over, or getting fired from our job. And that's understandable that our brain is having that reaction in trying to kind of tell us that story and prepare us for it. But there's a degree where that isn't useful anymore. That can be useful maybe to help us prepare if there is an actual imminent threat, but it's also important to be realistic about how things may or may not turn out. Like, it is possible that someone that we love, unfortunately, may pass away. Although if we look at kind of the mortality rates for different age groups and the course in general, the odds aren't 100% or even 50%. They're significantly lower than that. And again, I'd recommend looking at some of that data yourself to have more of a realistic sense of how that's playing out. But this isn't, a death sentence for certain for everyone we know. And again, we don't know for certain how the trajectory is going to be, but there's very good reason to believe that this is going to get better. Rates are already dropping in certain places, and there may be spikes at times, but over time we'll figure out how to cope with this more effectively, as well as have medical interventions that are successful. So there really is reason to look towards the future and think that things will get better and return to some degree of normalcy after all of this is done, and we could potentially learn a lot from it that's beneficial as well. Another great recommendation that Professor Sanderson talked about, and I've seen many mental health professionals talk about, and I've definitely noticed is helpful for me, is limiting the amount of time we spend on social media and watching the news. especially related to the coronavirus. And that of course does not mean being uninformed. It doesn't mean keeping up with what's going on. It means paying attention to and asking ourselves, do we need to watch the news for 3 hours a day, or constantly refresh our news feed, or obsessively be looking at kind of what the trajectories are? I would argue that that's very much not helpful and keeps us in a state of fight or flight and doesn't focus us on what we actually have control over. So if you're, and also the news tends to be tilted more towards the negative, of course. It's showing us a lot of cases of people losing their family members and young people getting sick and having to go to the ICU, and a lot of kind of highlighting the tragedy of it, which can, of course, be useful and motivate action. But again, it's not helpful to stay in that space. And they're not very often reporting about the 80+% of cases that are mild symptoms or asymptomatic. So it really can prime us to be in this unrealistic and unhelpful state that's detrimental to our own well-being. So what Professor Sanderson Alt pointed out too, that I thought was a great point, was he talked to some of his colleagues and clients, and he had them write down, if you're watching the news every day for a few hours, write down things that you're actually learning, and each day. And when they did that, a lot of it was just, there's 10,000 more cases in X area. And it's, again, how is knowing how many cases there are really helpful to eliciting action and motivating any behavior in a useful direction? It's just keeping us in the state of panic and fear. So what his recommendation was that I thought was great was once or twice a day, 3 times a day, look at a reputable news source with intention. So pick when you're going to look at this source and get an update on maybe what the trajectory is, what the government's recommending, what medical professionals are recommending, rather than having that going all day long and keeping ourselves in the state of panic and fear. I also think it's important to look at news sources that have a more positive, optimistic spin on some of the progress that is being made in helping with the coronavirus and some lightness to how people are coming together at this time. I really like Good News Network. They have stories on different advances that are being made in medical technology, companies and individuals that are making masks for people, looking at how people are still connecting, like doing funny things like singing out their windows to each other. So I think just to have a balanced perspective emotionally and intellectually, it can be beneficial to look at some of those sources to see where some of the light is coming from and where things are moving in a direction that is showing good signs for the future. It's also very important to remember that social distancing does not mean social isolation. It's certainly painful and creates feelings of loneliness where we're not able to physically be with some of our loved ones and some of our friends. But if we start kind of taking that and isolating socially and not keeping in contact with people, that can really exacerbate symptoms of loneliness and depression, anxiety, and all other types of mental illness and just general feelings of dis-ease. So luckily, there's so many different outlets now for keeping in touch with people. We're really lucky to live at a time where we can text people instantly, Skype, Zoom, House Party, all of the different video apps, phone calls, play games with people. So definitely take use of those and get creative. Again, there is a little bit of a depressing element to it to have that, video and phone and texting based relationships. But right now, and for many of us and in many areas, that is the most reasonable and responsible thing to do. And that doesn't mean we can't share with people and still have moments of joy and moments of connection. And on the note of using kind of the resources around us, I think it's also realistic to think of this as a time to build resilience and elicit gratitude. I definitely know that for my day-to-day, I have a tremendous sense of thankfulness for my living situation and the fact that we live at a time when we have internet and that even humans know what bacteria is and how it's transmitting. For most of human history, we were being killed off, most of us in our 30s or even younger, by this invisible force that we didn't know. We thought it was spirits, and, before civilization, people were just dropping dead and humans didn't understand why. So although this is not a great situation and there is a lot of suffering that's occurring, we're very lucky to live in a time where we have an understanding generally of how it's being transmitted. We have internet, we have food. We haven't run out of food. We have running water. We have many different resources to keep ourselves occupied, entertained, and engaged with people during this time. And I've talked to many people who have really seen this as an opportunity to try new things, to go back and start hobbies or projects or reinvigorate those that they hadn't. A lot of people who are working out more from home, using workout videos, doing yoga more, who are cooking more, who are playing instruments more. This motivated me to shoot a video, which I haven't done in months. And I made a space in my basement into a specific office because I knew I had to start working from home. And I always thought that I needed to go to the library because I couldn't focus, but I've been very successful focusing downstairs. So I think that in the midst of all of this, there is kind of a shared human experience where society is all uniting against one cause and we're working at it together. And there is some division in how to go about that, but we are all moving together towards fighting this. And there is an opportunity to think of ourselves as, well, you know, we have overcame or worked through this pandemic together, and we found creative ways to keep society moving, to keep our health going, and to stay connected with people. So I do think there is a lot of reason to be grateful for what we have and for the resources we have, and find common human connection and resilience through this trying time. And so, of course, one of the most important components of coping with all of this is not losing hope. We don't know exactly what the trajectory will be, but there's very good reason to believe that within a couple of years or even prior to that, we'll have effective medical interventions, we'll understand the course of the virus more, the economy will come back, and this isn't a lifelong death sentence or a apocalypse type situation. It's certainly bad and a lot's being disrupted, and there unfortunately is going to be suffering, but there's very good reason, I think, based in being realistic and not overly optimistic or Pollyanna, that things are going to start getting better again, and we might even learn something valuable as a society and as individuals from coping with all of this. I really appreciate your attention to this video. I hope that some of the things that I recommended resonated with you. I'm going to provide some links in the description to mental health professionals that had offered advice on how to cope and work through this pandemic. And I'll also put some links to professional medical resources and government resources that I feel are reputable and have good information on updates on the coronavirus, as well as what the best course of action is to mitigate them. So I hope everyone is staying safe and staying healthy. Be well, and I'm confident that we'll get through this together. I'll see you later.